Well, I am excited because here at Reckoning, health and wellness and fitness and taking care of your hormones is a large part of what we believe here because we want to be able to take care of our bodies to the best of our abilities so that we can go out with our families and show up for them and ourselves and be able to go on those adventures. And so many conversations with different guests happen to be around wellness, but now I finally have a professional here to talk about those things. And so I am excited to have you, Kayla, on so that we can kind of dissect a lot of the conversations we've had over the history of reckoning when it comes to those things. And you were someone that a follower, a listener had recommended and just thought that you would be the perfect fit for this type of conversation.
That's so awesome. I'm so excited about this.
I want to kind of get to know you a little bit, though, before we get into all those questions and nitty gritty conversations. I'm curious what led you to choose the career as a nurse practitioner?
Well, this is kind of funny because I was kind of thinking about this a little bit, and
Mm-hmm.
I mean, my mom's a nurse.
Mm.
She kind of led me down this path. I actually did CNA, which is like a certified nursing assistant, back when I was in high school. So I was 16 years old, and I actually worked in a care center. So I've been in healthcare for a really, really long time. I guess I won't tell you how old I am, but it feels like a really, really long time. But there was never like this aha moment of you're going to be a nurse practitioner. I think it kind of just happened along the way. I've worked in a variety of spaces when it comes to healthcare. I've worked in family practice. I've actually worked in orthopedics, which was actually one of my favorite things, wound care, the hospital setting, and operating room, which is also one of my favorite settings. But as I've just continued to do my schooling, I don't know, I think there's always been something missing. Like I wanted to help people the way I wanted to help people. And so getting my nurse practitioner was a way that I was able to do that and kind of do it my way. I mean, I'm still practicing very safe healthcare, evidence based
Mm-hmm.
within my rules, but I am kind of getting to put a twist on it the way that I really feel like people are going to get the most help. So I think it's always just supposed to, or has, it's meant to be this way for me. And I'm finally feeling like this is my spot, and this is kind of like my purpose, if that makes
Mm-hmm.
sense. So
Yeah, totally.
yeah.
And then that led you
Mhm.
into, did that lead you to like the clinic you are now in the do good movement?
Uh-huh.
Okay.
So do good is kind of came from two different places. So like I've had my own personal experiences with like anxiety, depression, trying to feel good, fatigue, having babies, like like I've kind of went through my own personal struggle, and during that I felt like I was really alone. Like I'm one of the only people going through this. Like, what is happening? And I've seen healthcare providers, and, we're really lucky. We really do have great healthcare providers, but I never was really given like a blueprint of like, hey, this is how you help yourself, or this is why you do this. They would say exercise and eat better, but like, how do I start doing that? Right? Like,
Mm.
where do I start? So it was kind of my own personal experience. But then as I got in my position in the clinic and talking to my patients, most people are experiencing these same things. We're tired, we're
Mhm.
having depression, anxiety, we're not really sure what's going on in our bodies, how to help ourselves. They're used to getting just medication thrown at them. So I really took a step back and was like, okay, like people don't know how to help themselves. And luckily, when I started my NP, I was starting in on my own health journey and really just, committing to myself. And I just wanted to help other people do that. And so Do Good Co is what it's called. We hold little events and just provide an environment where usually I speak or I bring somebody else in, and we just talk about, our first one was about like nutrition and exercise and what that means, what it means if you're drinking soda all day, but you have anxiety. I mean, caffeine releases epinephrine and cortisol in the body. So if we're drinking that all day long, that's going to affect our anxiety levels. And so we just talk about that and how to help people or motivate people to feel good. And then we usually do like a little workout or a physical movement because I love that. I'm very into that to kind of help people show them that they can do it. You know what I mean?
Mhm.
And if they do good for themselves, then we can, have that energy going outward into like our families, our friends, and our community. Because when you're not feeling good, like all of your energy is kind of turned inwards. Like I was taking care of my kids, I was doing that, but I was in survival mode. I was focusing on me and my little bubble, and that's all that I could do, right? But now that I'm in a very different place health wise, like I am helping a lot more people. And so, I mean, there's a big picture to
Yeah.
all of this, and that's kind of what Do Good. I'm trying to get that out there and, make an impact. And while we're doing that, usually we donate to like a good cause or something like that as well too. So it's kind of bringing it full circle, taking care of you, taking care of other people as well too.
I love
So
that. And I think even today, it's funny, I've done another interview today, and the theme seems to be like today with having almost like your low point and challenges thrown to you, but then
mhm,
taking those moments and as your movement is you do good with it. And
right,
it's
right.
really powerful that you've been able to do that. And then also from like a medical standpoint and me being a patient coming to somebody that, especially as a female too, like to be able to come into
Hmm.
you and know like you know how I'm feeling or you've been there. I think there's a
Right.
really special um gift there in that ability.
Yes, for sure. And I've definitely seen that. Like, did I want to really go through all of like what I did? Not really. Like, I'm so glad that I had to figure it out for myself because I can walk people through that. Like, and just like you said, like, it's kind of what life is about. Like, having a trial, having something happen, and then doing good things with it. Like,
Yeah,
I mean, makes it great. Yeah.
definitely. That sounds like a really credible an event and a fun way to get people involved in their health and fitness too.
Oh yeah. It's been honestly, it's been so fun. Like I've had patients or like friends that I'll never run. I'll never lift weights. I'll never do that. And then all of a sudden they're like posting on their Instagram they're running and I'm like, I have definitely rubbed off on you just a little bit.
Since following you, I have been running more. So I will say
Yes, yeah.
all about the
Mhm.
running. And a large part of like the story that I'm hearing, and I know this is something that you specifically say in your bio and when we spoke through email, that you like to treat the root cause of health. Can you
Mhm.
explain what you mean by that, like targeting the root cause?
Yes, so root cause, I'm very, very root cause. Like I like to know what's working and what's not working, even if we're doing like a treatment. But targeting root cause, I think in medicine, we've kind of missed the boat just a little bit for the most part. And I think part of that, I don't think it's like necessarily providers' intention. I think our healthcare system is just extremely stressed. And when it comes to like educating the patients or taking the time to really dive into patients' health, it's a stressed environment. Like it really is.
Mm.
Luckily, I have a practice that I'm able to control that quite a bit, so I have time for my patients. Um, but targeting root cause is so a lot of times when a patient comes into me, you know, I do blood work because what we're looking for is there like a medical condition causing your symptoms. I look for hypothyroidism, we look for nutrient deficiencies, we look for autoimmune diseases. We don't want to miss something and just say it's lifestyle, right? So we look at that, but then we also need to be okay, is this person experiencing fatigue because they're under eating, they're not eating nutritious food throughout the day? Are they not sleeping? And are they not sleeping because it's anxiety related? Or are they not sleeping, because they have a different disorder or those types of things? So it's really just figuring out why a person is responding the way that they are. You know what I mean? Like, why are their symptoms happening?
Mhm.
And not just, oh, hey, your blood work looked at it, looks good. Nothing I can do here. Good luck with life. It's really, okay, hey, your blood work actually looks really good, but let's talk about your daily habits. Let's talk about how many hours of sleep you're getting. Let's talk about, are you having any life stressors? Is something situational happening? Are you having depression? Do you have anxiety, and why? You know what I mean? So it's really figuring out why people are having symptoms, is targeting root cause, and that's what we do. And of course, I'm a healthcare provider. Like I definitely want to make sure there's not something medically, like a medical condition we're missing.
Mhm.
Most of the time, it is a lot of lifestyle. But there has been the times that, I have found something that's going on that, somebody has missed, So it's really figuring out what's actually going on in somebody's body and why.
Mhm. No, it's
Right.
I love that. It's because you are taking like the skills that you have and your medical
Mhm.
training and then combining the two to where you can do that. Do you have tips for people? Because I know I've personally been in a place where I knew something was wrong. I just wasn't feeling good, which it sounds like you know
Yep.
this feeling. And you go
Uh-huh.
and get your blood work done, and it's like, oh, it's coming back pretty good, like vitamin D definitely kind of low, but still like, okay, changing that, and it's still not feeling good. And then just kind of feeling frustrated, and it almost kind of makes you step back a little bit and your motivation almost leaves because you're like, oh, I'm trying all these things. But it did take me kind of going to a different route to do
Uh-huh.
to get the help I needed. Do you have any advice for people to like advocate for themselves or kinds of different kind of things you would like look into for someone that's maybe just not feeling like themselves?
Yeah, so you actually, already nailed it. It sounds like you found a provider that works for you. I think that's the number one thing is going to a provider that will listen to you. I'm very surprised, like being in my position, how often I hear, I felt like you heard me and I felt like you listened to me. Like I'm actually shocked. It's the number one feedback that I get from my patients.
It goes a
Like
long ways.
I don't it does, and that makes me feel good because obviously I like to be listened to as well too.
Hmm.
But you need to go to somebody that will listen to you and take you seriously and not just like brush it off. I personally feel like I appreciate it when my patients are like, "Hey, I know my blood work's good, but this is how I'm feeling, and I really feel like something else is going on." So, I mean, finding that provider, and sometimes it is hard. There are so many good healthcare providers. Like, most people are not in healthcare to not be awesome, right? Want to take care of people, but there's a handful that
Hmm.
are here for other reasons, maybe I don't know, but you need to find that person. And then advocating for yourself as well too. I think it's really this is the other part of it as well too. I think really taking a step back and being able to like be okay with knowing maybe I'm doing something every day that isn't helping me.
Hmm.
Maybe, something I'm eating every day or something that I'm drinking every day isn't helping me get the sleep that I need or regulate my hormones. So I think there is two parts of it, but definitely making sure you're going to somebody that's listening to you and will take the time to be like, okay, what are you feeling? Like what's going on? And ask you all the questions. I ask a lot of questions. People are like, why are you asking that? And then, of course, I explain it, right? Like, I
Yeah.
don't just say, like, oh, I'm asking you, or I'm just wanting to know everything about your life. But I do go, hey, are you having like a life stress? Is something happening in your family? And they're like, well, why do you want to know? And I'm like, well, because that affects your stress, which affects your hormones, which affects your sleep. There's so many things. It's a
Hmm.
cycle, right?
Hmm.
So yeah, listening and then being able to take a step back and look at, okay, what am I doing to help myself or not help myself per se?
Yeah. I think that's a fantastic tip too. And sometimes it is kind of having to swallow your pride a little bit and being willing to answer those questions truthfully. I always say, like, take an
Yes.
audit of your life and assess that. And it sounds like that's the perfect time to do that and be willing to answer all those
Yeah.
questions that you're asking.
Yeah. And I like that. Take an audit of your life. Maybe I'll use that. I like
Yeah.
that. That's really,
It's
really cool.
helpful. I do it often. It's like a once a week audit. Sometimes I'm like, wait a second,
That's,
right? Like, find the things that make you feel good and then go through and be like,
yeah.
am I hitting these? Wait, no, I see now. But again, that
Yeah.
can,
Exactly.
yeah, it can happen with, that's a lot of how I figured out um, what was working for me and not working for me was
Mhm.
honestly just getting truthful with myself too. I mean, yes, there were things that
Which,
needed to be changed, but I also had some kind of control over certain aspects of that to help myself.
yeah, right. And sometimes my patients aren't ready for that. Like, so I kind of baby step them into like, hey, there's more to what you're doing that's affecting you. You know what I mean?
Mhm.
So I do have a way of working that as well
I
too.
like that
So
one step at a time. Well, it's always easier to
baby
build that
steps.
foundation.
Yes, for sure. Baby steps.
Um,
That's what we always say. Baby steps.
Baby steps. I've mentioned obviously, and people have heard my story in regards to just like my hormones and coming off birth control and then becoming a new mom. And then you get
Mhm.
into your 30s and 40s, and a lot of our audience is in that age group now. And a lot of things change. You're not that 20-year-old
Sure.
self you used to be. Um, and I'm realizing so much, even just watching not just myself, my girlfriends, but my husband and, our hunting buddies, our guy friends. We're all learning that, like, we kind of have to step back and take care of ourselves, and our hormones are all playing. We're also individual, but all of us are kind of playing with hormones in a different kind of way. Are
Mhm.
there tips that you have maybe for women and then also men when it comes to the importance of taking care of your hormones and maybe things that you're seeing often?
Yeah, for sure. So, I mean, you're right on. Like, especially women, it's hard to keep up on all of our changes.
Yeah.
Like, I
It's like
mean,
every
we're just
year.
constantly, yes, we're just here for the ride,
Mhm.
basically.
Yeah, strap in.
Yes. So like especially what you said, like 30s, I mean, that is kind of like a good turning point is like 30s. When you really have to be like, oh, okay, what I'm doing is affecting my body and especially my hormones because they drive a lot of things. Like, I mean, they're very, very important in a lot of bodily functions. One of the biggest things that I have most of my patients do is definitely protein intake. Okay, like protein. I know there's a lot of like fad things about like intermittent fasting and keto diet and like all of these things, but a well balanced, like getting 30 grams of protein per meal. Obviously, if we're like lifting and being like really physical, which I believe you're pretty, I mean, you do a lot of physical things, hunting,
Yeah.
lifting, all the things, right? So
Yes.
you need a lot more protein, right? But generally speaking, women that aren't doing that, intense stuff, about 30 grams of protein per meal is really, really important. And I do recommend a breakfast versus like a fasting situation. And like I said, it's a little bit different depending on what you're doing physically. But generally speaking, that helps like keep our blood sugars in check, which, in turn, if they're all over the place, that's going to affect your hormone function as well too. I have a big one. Caffeine is kind of one of those things that I don't want. I mean, you can have some, but it's like the daily, and with all the added sugars, like a soda pop every day usually needs to go. So I know I'm a horror. Everyone's like, why? Why? But I mean, added sugar in your diet, and if you're getting it with something that doesn't have a nutritional value, like, I mean, you're creating inflammation. I mean, just this stress on your body that you don't need to do, which in turn your hormones respond to that. So, protein, added sugar intake, strength training, especially for women after 30, is very, very important when it comes to managing hormone health and muscle mass, and set you up for strength in the long run, making sure your hormones are regulated. And I think people kind of miss the boat. We're thinking like skinny, like weight management. What I like my patients to think is think strong.
Mm.
We want to be able to pick up our grandkids. We want to be able to be the fun grandparent. You know what I mean? We want to be running around doing fun things when we can enjoy life versus, hey, I didn't really take care of myself when I was 30. Now I'm 50, 60. I should be now enjoying life and I can't because I'm having a lot of issues. I don't have muscle mass. I'm not strong. Those types of things. So for women, protein, I mean, fiber. Fiber is really important. I think some people forget about fiber.
Mm.
About 20 grams of or 25 grams of fiber per day is really, really important. And then men.
Yes.
I like my if any of the guys that come to me listen to this, well, they'll probably laugh because I'm not gonna lie. I put my guys kind of through the ringer before I put them on testosterone therapy because this is where root cause comes in, okay?
Okay.
Um, if they're excessive caffeine drinkers, not really lifting weights or doing anything, living a pretty sedentary lifestyle, not eating very good, chance are testosterone levels can be low and they can feel fatigued, right?
Mhm.
Um, so I want to make sure that, like, same thing with women, they're getting good protein intake. They're maybe doing some strength training. They're not drinking soda pop or something caffeine loaded. I mean, you can do like a pre workout and stuff. That doesn't stress me out that much, right? but loaded, just added sugar, soda all day long, they can't, I'm like, we got to fix that before I'm going to put you on testosterone
Mm.
therapy. Vitamin D is actually really important for testosterone
Oh,
as
interesting.
well, too. So, in fact, I had one guy that came to me, he's like, I'm tired, I don't feel good, I'm not sleeping, all of these things. So I put him through the ringer of like, well, we're going to check your vitamin D. It was tanked. It was super low. So I made him do vitamin D injections. I had him start lifting weights. We tried to get him to sleep. He wasn't sleeping very good, and his testosterone levels did come up, but he was still having symptoms. So I did put him on testosterone therapy because we were doing all these other things. They were in place,
Mm.
some of the things you can't replace. And then, I don't take it lightly putting him on therapy, but there's obviously a time and place for it. So,
Right. But you
but kind of the
tried
same
all
thing
the
as
other
women.
stuff.
Yeah, because there
Interesting.
can be side effects to testosterone therapy.
Mm-hmm.
Cardiovascular, it can thicken your blood, so chances for blood clots go up a little bit. And then prostate cancer is actually one of the side effects as well, possible side
Oh,
effects as well too. So
oh, interesting. It's always good to know the side effects
yeah,
too, because people are always so focused on like what it's supposed to do for you.
right. And it can do great things. Like it really can. I mean, he's doing great. He's doing good. He was done having kids. So men that aren't done having kids should probably not be put on testosterone therapy because it can impact their fertility as well too. So I mean, it's very individualized. My personal opinion on that is,
Mm-hmm.
and yeah, I
Is
make them do all the things
testosterone,
first.
yes. Is testosterone therapy something that you do for like a span of time and then cut back?
Most of the time, once they're on it
They're
for
on
the
it.
rest of their life. Yep,
Okay.
because their body doesn't necessarily, it gets in the habit of not making it basically,
Mm.
because we're putting it in the body. So that's why I want to make sure it's something they really want to do and are very aware of.
Mm-hmm.
This is probably a lifelong thing.
Yeah.
So, and it's usually an injection, so
Mm. Okay.
not super fun to have injected, but some men are fine with it.
Yeah.
So.
On both the men and women front, I know you mentioned like weight training. Why is that something that's so important? Because I think for the longest time too, so like I'm a product of like the 90s, 2000s, and especially for women, right? It was like run and like Pilates and all that stuff, which is great. And there's a place for it, I think, in your routines. Clearly, I know you're a runner and you love to run.
Yeah.
And then for men too, sometimes I think some men that also grew up in the same time frame have the mindset of like the bros, like the gym bros, bodybuilders, and there's
Yes.
not always the extreme in between all of that. What is it about weight training that you think is so good for the health and the hormones?
So weight training. So I mean, kind of what you said. So we'll kind of go back to how people are perceiving health is like skinny, right?
Mm,
Like if we're skinny, we're healthy, and that is not necessarily true. What's happening and what has happened, like you said, the 90s, how women were trained or men, what we were told is eat less, exercise more. But really, what that does, I mean, it slows your metabolism down and reduces your body. I mean, your body mass or your muscle mass. Okay, so if we don't have any muscle mass, our hormones are going to respond to that, but we're also going to be weak and break our hips and our bones. I mean, we're going to break everything, right? And so that's why everybody's at high risk when we get older. So how it works in like your metabolic health, your muscle mass, I mean, overall regulating, it's like your fat ratio to like your muscle mass, and it's like a thermogenic effect basically is what it is. But my thing for it, I don't know. Have you heard of semaglutide before?
yes. Mm-hmm. It's like
So
all
it's a
the
big
rage.
thing, right? Ozempic.
Yes.
Yes. Skinny. Everyone's getting skinny and everything on this. So
Mm,
what's happening? And I do offer it in my clinic, but I offer it as a tool. I don't offer it as a fix.
mm.
Like my patients know coming to me, we're utilizing it in the right way.
With lifestyle
But what's
changes.
happening, yes, because what's happening is it shuts down your appetite. You're not eating, but we're not changing what we're getting nutritionally. We're not getting enough to support ourselves. People are losing muscle and not fat. So they're coming out as it's a term called skinny fat that puts them at risk for all of the metabolic disorders that we're trying to prevent people from, which is cardiovascular disease and diabetes and those types of things because of how it impacts your hormones and creates insulin resistance in your body. So strength training, all of that is really important to protect all of that. Does that make sense?
Yes, totally. Yeah. And I've heard too, isn't it good for like your bone density? So like as you were saying, as you get older, it helps
Mm-hmm.
hopefully, so we're not breaking so many hips.
Yes, yes. So, like all of my perimenopausal people,
Hmm.
and they come in because they're gaining weight, they're having hot flashes, all this stuff, and I tell them to do strength training, and they're like, "What? What do you want me to do?" And I'm like, "I want you to be strong, so you're not falling down and breaking your hip in 5, 10, 8 years, whatever it is." So yeah, I mean, it protects everything. So
Very cool.
super important.
Yes, I love hearing that because obviously I I love doing it. But it's
Uh-huh.
always nice to know that
Yeah.
there's like a benefit to it. Like I'm not just trying to be like some days I'll tell you for sure. Some days it's vanity driven when it's like a really hard workout. And I'm
Yep.
like shorts, 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 you know? And then
Yes.
other days I'm
Yes.
like, no, it's so I can, yeah, when I'm out hiking and doing stuff or like packing out an animal, it's like, this is also why, and keeping up with my busy kids.
Yep. Yeah. And you are strong enough to do that because you strength train. Like, I mean, there's just so, and people end up loving it. Like, most people are like, I am not doing that. And I was one of those people. I was like, I have never pictured myself lifting. Like, the first time I picked up some dumbbells, I was like, what the heck am I doing with these things? But you figure it out.
Yeah, you do. I think you like after so many weeks too, you're like, oh, I think I kind of get it now. I feel better after.
Yeah. Oh, yeah. You feel good. You're noticing a difference in your body and maybe even mentally. They're coming out with some studies, like muscle contraction and how that affects like dopamine and stuff as well too. So mental health benefits are also there. So
Interesting. That's
there's
what I
not
was just going to lead
not a lot.
into.
Yeah.
Is if you thought that there was mental health benefits with working out.
Oh yes, for sure. Like mental health and physical health go together. I think in the medical field we used to look at body systems so differently. Like the brain is the brain, the belly is the belly, the stomach is the stomach, the muscles are the muscles. Like we just looked at everything so separately, but they all go together. Like I mean, when you're nervous, you get butterflies in your stomach, right? Well, that means
Hmm.
your brain and your stomach are connected. So you have the gut, it's called the gut brain axis. So, I mean, you can't be mentally well and physically destroying your body or vice versa. You can't be mentally unwell and becoming in the best shape of your life. Like they go hand in hand. And that's why, I kind of mentioned like I offer weight loss in my clinic, but it's more of like a wellness program because all of it goes together. Like it all goes together. And I think I
Hmm.
mentioned before, like I've struggled with depression and anxiety, and I thought the only answer for me was medication. And I'm not saying that that's a bad option. Like there is definitely a reason like we need to have that, especially for some patients. But mentally and physically when you're taking care of yourself, I mean, it's amazing how you're able to handle those emotions quite, a lot better. And
Hmm.
I'm sure my husband can attest to that.
Oh yes, mine too. Mine too. I'm like, it's been a couple days. It's time for me to work out for everyone's best
Yes, yes,
interest.
yeah, yeah. And you do feel better, and it's like you can walk yourself through situations. And I mean, I don't know. It's definitely all related for sure.
Hmm. When it comes to hormone health too, I'm
Uh-huh.
noticing too a lot of them are talking more about like I would never guess from the outside looking in, but just like feeling a low, oh like I've never felt sad or depressed before. And now I'm kind of like, yeah, I'm not as happy as I used to be. Do you see like the hormone health a lot of time is tied to that?
With men,
Yes.
um, I think a little. I mean, I don't have like a huge men population. I think some of them are like grew up with me that are in this age, and so few of them will come in, but some of them not as much. But I definitely have seen that there could be that component. But that's kind of going back to like okay, are they having some depression because of their hormone, or are they having some depression or a low feeling because maybe they're not sleeping, or maybe they're not getting the nutrition they need, but they're going and busting out a hard physical day at work, or something like that. But
Mm-hmm.
I definitely have seen it correlate, because when they're not men, when they're not feeling like they're strong and doing what they should be doing, definitely tend to get a low feeling. And if that's because of testosterone, sometimes it definitely can be. So
Mm-hmm.
we'd see it. But like I said, that's going back to like, okay, what's the root cause of, like, really why are they
Yeah.
feeling the way that they're feeling? Does that make sense?
Yeah. Yeah, for sure.
Mm-hmm.
And I think it's good to have that conversation too, because now so more than ever, I think people are being more open about it, especially in like the male population. But I
Mm-hmm.
think it's good to have that conversation of like, look, a lot of times I think they hear it for women, right? Like, oh, like her
Right.
hormones are off, or she's tired because she's dealing with the kids, or her eating's just not so good
Mm-hmm.
because, she's busy cooking for everyone else and then forgetting to eat herself. But I think a lot of times people forget to look and step back and remember that men have these outside factors that
Yeah.
can cause those issues as well. And it's okay to
Well,
address
and
those
I
and talk to someone about them.
For sure. And I think some of the men that do come in and like I kind of open up that conversation at first, like they're really taken back of like, do I want to have this conversation? Like, is
Mhm.
this okay for me to feel the way I'm feeling? But usually, if like honestly, all I have to do is like, it's okay if you feel this way. Like, let's do something to fix it. Like, and just letting them know that it is like a safe spot. I
Mhm.
mean, and yeah, it is normal for them, probably now more than ever, because if you think about it, like most households, both parents are working, and so a lot of that responsibility is placed, you know, on them as well too, taking care of kids and going and
Mhm.
doing physical work, and all of this stuff as well too. So yeah, definitely. I mean, now that you're even saying it, and I've kind of paid attention to it a little bit, it's kind of even opened my eyes just a little bit more of like, am I
Mhm.
making sure these guys have a good spot to let you know what I mean,
Mhm.
to be able to have this conversation. But normally I do ask about like depression and anxiety, and it's kind of surprising. Some of them, I mean, it takes a second, but some of them will open up about it and be like, I guess this is what it is, but I'm not really sure that this
Mhm.
is. Am I allowed to have feelings?
Yeah.
Yes, men are definitely allowed to have feelings and feel certain ways.
And I
So,
wonder if it's because like maybe depression and anxiety, it all I think it looks different on everyone too. And maybe it's
oh,
different for men than it is for women as far as like the men's perspective. I don't know.
yeah, for sure. And I think men are, yeah. I mean, I know that like they're a little bit more closed off with, I mean, women most of the time we wear our emotions pretty like out there. So
Mhm.
people know how we're feeling for the most part.
Yeah.
But I think men are pretty good at just, oh, I'm going to deal with it today. You know what I mean? Like I'll just be fine and deal with it. But they
Yeah.
shouldn't have to.
No, they should not. Totally. So, if anyone's listening
Mhm.
and you need to like you're having those feelings, just make an appointment and go.
Yeah. Have a
I
conversation.
read something on your Instagram that which you guys need to go to Kayla's Instagram. It's super awesome, inspiring, and she gives lots of good tips. But something that I think, especially right now with social media, is there's so much information online, and you're always seeing like different trends. And you had an Instagram post that says, we can't replace actual movement, sleep, or nutritious food, no matter what supplements you take. Can you
Yes.
elaborate on this? Because I think so many people, it almost comes back to like you with the root of the cause. It seems like so many people are
Hmm.
just always trying to like almost band aid. They don't want a band aid answer from the doctor, but they're giving themselves kind of like that band aid fix with supplements.
Yes, correct. So, I mean, supplements can be great. Like, I'm not bad. Like, if you take a supplement, that's fine. But you also, like, no matter what supplement you take, it's not going to get you up and make you go move or go
Mm,
out for a walk, or, you know what I mean? Like, if you're not doing that and you're just taking a supplement, like, it's not going to work. It's not going to regulate your hormones. It's not going to help you feel better. I think just like you said, we're in a quick fix world. Like that's what we are. Like a quick fix world. I don't have time. I don't have energy. I don't want to put any time into myself. So I'm going to just take the supplement and it's all going to be better. Not necessarily true. right? I have patients that are like, I can't sleep. Okay, well, they're like, I started the supplement and it's not working, like a magnesium or something, which magnesium can be great for
Mm-hmm.
sleep. Like, that's perfect. And I do recommend it most of the time. But if we're not doing anything all day, our body's just sitting there, of course we're probably not going to be sleeping at night, right? Like, I mean, it's those types of things. Like, you can't replace getting up and moving. You can't replace sunshine. Like, you can't replace putting good food in your body. No supplement can really replace getting fruits and veggies,
Mm-hmm.
whole foods. Like, we do. I mean, I will say, like, just the way the world is, and maybe we're not getting the maximum nutrients out of our food anymore like we used to. So supplements can come into play there. But definitely, I wouldn't, if I'm being honest, I wouldn't spend thousands of dollars on supplements and think it's going to fix all your problems.
Yeah.
I would definitely put in going on a walk. Like, and that's where I found, like, meeting my patients where they are. If they are literally sitting on the couch, like, my goal for them is walking 3 times a week. You know what I mean? But if
Mm.
I have a patient that's pretty active, we'll go on a walk, get some steps in. Then my next step for them is figuring out how to do some strength training. So a supplement's not going to contract your muscles. A supplement's, I mean, obviously there's chronic illness. There's reasons why some people can't do that. And I do put, like, some of my patients, like, in the care center and stuff, on supplements to help with that. But you can't replace it, right? Their
Mm-hmm.
muscle mass isn't going to regain if they can't walk. Same thing with you. If you're capable of moving your body, we're going to have to
Move
move
it.
it to get things to work. Yeah.
Are there vitamins and supplements that you like that you suggest to like your girlfriends on the day to day, or ones that you take that you
Um,
could suggest?
yeah, so there is a vitamin supplement that I actually really like that I promote most of the time in my clinic. It's called Energy Nutrition. It's actually made in Utah. I was searching all over for a vitamin that I liked, and it's just actually right up the road from us.
Oh, how
But
funny.
it's called, yeah, I could, and it's on my Instagram. I think it's in one of my highlight things, but it's Energy Nutrition. They have really good clean products, like clean products that when you're getting vitamins, you got to be careful that there's not any added sugars in them. Gelatin, those types of things aren't really good for your body, especially for kids. Like,
Okay.
kid vitamins, watch for how much added sugar, because obviously if you're giving them 5 grams of added sugar a day, it's probably combating their immune health
Yeah.
versus just not giving them the vitamin.
Good to
So
know.
energy, yeah, that one's a good one. Pro 6. Have you heard of Pro 6 before?
Mm-mm.
So it's actually, yeah, one, it sounded too good to be true. So I actually met with the guy and he dropped all the science on me and I was like, okay. So it actually is kind of like a protein. It converts to 30 grams of whey protein. Very clean. I've personally been using it lately and I have gained a lot of muscle just by, I mean, I obviously exercise kind of intensely, but I've actually seen quite a difference in me using it. Elevate Life, I think, is what it is, and I can put that on my Instagram as well
Okay.
too. It's kind of a newer thing, but Pro 6 is really actually pretty awesome, and I give it to my kids too.
Yeah. That's always
I have
nice.
it in, which is safe. Yeah, it's safe for kids. It's actually one of them that I recommended for one of my care center patients as well too, to protect their muscle mass as well too. So,
Very good.
but yeah, when you're looking for vitamins, just added sugars, gelatin, just make sure they're clean, blends, those types of things. So
Okay.
there's lots out there.
And do you suggest that people be on like a daily vitamin, like a women's health vitamin or like a men's daily vitamin?
I mean, it depends on what nutrition's looking like, but generally speaking, it's definitely not going to hurt you.
Okay.
I do recommend, I mean, you should probably get your vitamin D levels checked, but generally speaking, most people can benefit from a vitamin D, magnesium. So if that's in a multivitamin, that's usually pretty good. So
Pretty good.
you
Okay.
can get too much vitamin D. So, I mean, if you've been taking a lot of vitamin D over a long period of time, you should probably go get your blood checked because it can cause toxicity. So, but if
Oh,
you're taking a
interesting.
pretty low dose, yeah, yeah. So you got to be, I honestly, I have seen one level that is above normal. So, but it can definitely happen.
It could
It
happen.
can definitely happen. Yes,
How
for sure.
interesting. And
Yeah.
I'll tell you just from experience, like vitamin D deficiency is no joke.
Yeah. It,
It
have you
affects a
had vitamin
lot
D
of things.
deficiency?
Yes, I
Yes, it
did.
does. Yes. Well, and that's what I also find interesting is that's not something that was really talked about when I went to medical school. And like, hey, this is like a screening blood work. Like a lot of people don't really screen for it unless someone's like, I'm really, really tired for like the fifth time. And then they're like, okay, let's check your vitamin D level.
Mm,
But it has so much to do with bodily functions like weight management, cancer prevention, bone health, fatigue, depression, anxiety. Like there's so many things that it yeah, I always screen a vitamin D. So
yeah. I was grateful that I finally
yeah,
did. That was one of the things that helped kind of make a big difference for me was getting that
for
figured
you.
out. Yeah. And
Yeah.
yeah, and I mean that was like middle of summer too. They were like, "Are you outside a lot?" I'm like, "If you only knew what we did." Like it's not from a lack of not getting sunshine. I'm
Yeah.
like, "Yeah, that's kind of
Yeah.
concerning." Like, yeah.
Yeah. Do you remember what your level was or like how low it was?
Mm-mm.
I mean,
Isn't
that's
like I
not
think it was
something we
like
would.
10? I don't
10?
know. Yeah, it
Okay.
was like
That's
they
pretty
were kind
low.
of deciding what to do with me.
Did you do like vitamin D injections or anything like that?
I didn't do injections, but they sent in like a really high dose of vitamin D that I had to
Prescription.
get up, yeah, the pharmacy. And then it was
Okay.
like, take this
Gotcha.
for a couple weeks, come back and we'll check. But it was wild,
Okay.
even just, I want to say those 2 weeks on it, just 2 weeks on it made a huge difference.
A huge difference.
Yeah.
Yeah, 10 is pretty low. I like to see 50s on my patients' vitamin D levels, and very rarely do I get to see that, but
Yeah. Cause I think they were like 30s kind of like low and you're at like 10. But
yeah, that's pretty.
yeah, I was
I think the
having all those like depression, anxiety, even though I was working out and eating well, still wasn't seeing a
yeah,
difference. My energy was just gone.
go on.
Yep.
Uh-huh.
Yeah.
Yeah. How about and you said you weren't sleeping well either?
I wasn't sleeping well. Mm-mm. I would always
Hmm.
like either I would end up going to sleep late and then still end up waking up at like 3 o'clock in the morning for like an
Okay.
hour and then going back to bed. Yeah.
Okay.
So
Yeah.
I'm always like that vitamin D.
Yeah, it's super important and like people are like, "Oh, yeah, I was diagnosed with a vitamin D deficiency a while ago." And I'm like, "Well, what was it? Like how long are you not taking vitamin D?" And they're like, "No." And I'm like, "It's so important. You should be." So, I think the lowest
Yeah.
level I've ever seen was 7, which yeah, low normal is 30. Yeah,
Yeah.
30 to 100 is
Yeah, it
technically
was
normal
crazy.
range, which is just a huge range. But
That is a huge range. Yeah, I was
yeah.
excited the last time I went in because I do keep up now on like just my vitamin D supplement because I know that, and we live in Utah, so like especially during the winter fall months. But the last time I went in, he was like, "Your vitamin D looks so good," and I was like, "Yeah." Like I
You're
haven't had
like,
a high
yes,
vitamin D in so long. Like I feel so good to be on this side.
you've made
I
it. You've made
made
it.
it. Yeah, but I do notice like if I go I don't know if it fluctuates that quickly or if it's just my head, but like if I go a week and I forget to take my vitamin D, I'm like,
Hmm.
"Oh, yep, that's one of my audits to myself." Like we need that vitamin D.
Yes, you do. And it's super important for like hormone health and stuff like that. It's one of those drivers. It's got to roll. So,
Those see, good to know. Is let's say there's someone trying to get their hormones balanced. Is there kind of and you kind of did give us, I guess, a little bit of a base for this. But is there something, especially like let's say a female comes in and she's feeling tired, um, and she's not really noticing like changes in her weight, just sluggish. Is there kind of like a blanket based nutrition and workout strategy that you give? Is it that protein and that working out?
yeah. So like I said, I kind of meet my patients where they're at. If they're most women in general are not getting enough protein.
Mm.
Like even my patients that we've talked about it, I'm like, "Are you getting enough protein?" They're like, "Oh yeah." I'm like, "Okay, let's talk about what you've ate." And I'm like, you're getting maybe 45 grams a day. Like we need to be 90 to 120 is pretty typical of what women should be getting. So
And
I
can you
do,
explain
you know,
why the protein's so important?
because basically of muscle mass and metabolic rate and
Oh,
all
okay.
of that and how it affects your hormone.
Okay.
Um, I mean, we could go really deep into like visceral fat and all of that, but it gets kind of gets a little wild.
Okay.
But basically, metabolic supporting, if you have more muscle mass than fat. I mean, women do need a little fat. I will tell you that. Like, women do need a little bit of fat. We're supposed to have a little bit of fat, okay? But obviously not excessive.
Mm-hmm.
Um, but yeah, so basically what I do say is we start out with 30 grams of protein per meal. I give them like a little paper. Sometimes depending on where they're at, a lot of times I will recommend like doing like a protein shake, like Fairlife or something. So I know that we're, as they're figuring out eating and how to get that protein in, I know that we're getting some, at least a good morning 30 grams of protein. And then like the 25 grams of fiber is also something really, really important. Kind of helps things just keep going. That also relates to visceral fat as well too, and how the hormones regulate themselves in regards to fat. But then, yeah, it's either walking 3 to 4 times a week or strength training 3 to 4 times a week, just depending on where they're physically at. If women are like perimenopausal, I don't really want them just to go ham on strength training. Just like, hey, don't go injure yourself doing strength training. I recommend like a weighted vest when they're walking or doing household
Mm.
chores as well too. So that's something that can be helpful and beneficial. And then of course sleep. Sleep is one of the biggest things that we look at, just because that impacts hormones and stress and everything so much as well too. So
Yeah.
sleeping, and if they're anxious or have depression, we definitely address that as well too. Because if you're in like a heightened state all of the time with anxiety and those types of things, that's one of the biggest things that impacts hormones is stress. And people kind of don't like that answer,
Mm-hmm.
but it definitely is one of the biggest things. So, I mean, very individualized, but those are kind of some of the basic things that we
Yeah.
address.
Definitely. It's
Mm-hmm.
very so individual, especially when it comes to something like your hormones. Is there something
Mm-hmm.
like, as far as, because stress obviously does play such a large role, are there little
Mm-hmm.
basics for stress management that you have?
Yeah, so a lot of times I'll like recommend honestly walking because that's a decompressor,
Mm-hmm.
listening to a podcast or music that they like. I think a lot of times women just don't take time out for themselves to be like doing something they want.
Mm-hmm.
Like really 30 to 40 minutes is not asking a lot. And I get situations are very, very different. But stress relief, like walking, listening to something that they like to listen to, meditation is huge. I have a lot of women that struggle going to sleep at night, and so we do what we call a body scan for sleep. Have you ever heard of
Mm-mm.
one of those before?
No.
Usually, I think it's called Mindful in Minutes podcast. There's a body scan for sleep on there, but you could really find probably one a few places. But it just basically goes through your whole body and like has you relax, like your fingers or like your foot, or I mean, it goes through
Okay.
all of your
I
body
have
parts to
done that
relax them.
before through
Yeah.
meditation. Yes.
Yeah, yeah. So
And you don't
it's
realize
just
like
called a
you're
body
clenching
scan.
your jaw. It's like,
Hmm.
tells you like,
Yeah,
relax your jaw. And you're like, oh,
I am.
relax
I
your
am stressed
brows.
out.
Yeah.
Yes, yeah, for real though. So I mean, we'll do stuff like that. And if like women are really like if they're single moms and like really have no one to help them, we honestly work on like breathing techniques of like
Mm,
taking 3 big deep breaths, like and maybe like magnesium to kind of help because that helps with stress as well too, and kind of calming the body and muscle tensions. So
okay.
I mean,
Eh, eh,
individualized, but
yes, definitely. Is magnesium something that you take in the evening that you recommend?
yes. Magnesium glycinate is what helps sleep. So,
Okay. I
yes,
know
that
there's
is definitely
different
something that you
types of
can take at night.
magnesiums.
Yes, so magnesium
Okay.
oxide and magnesium citrate are the other two. Magnesium glycinate is the one that I use the most. The other two can help with like constipation and those types of things. But
Oh,
magnesium glycinate is the sleeping
the sleeping.
one.
Okay, that's good to know. That's helpful because yeah, a lot
And
of people don't realize
stress.
stress.
Yeah.
The
Yeah.
stress.
Yeah. So that's, I know. I think it's just our world that's like fast moving and constant makes you feel stressed. But I don't know. I think personally me, like I've came a long ways on figuring out how to manage stress because I just felt I've always been that person that just does everything and it's fine and it's okay and you can just do it. And I think a lot of people, the more I've talked to people, they're just like that. Like, don't complain. Like, we're just going to keep going and I'm going to manage everything. But something I like to use for stress is, whether you're a mom or whatever you're doing, we're all doing a lot of things and we're juggling a lot of balls, but we have glass balls and we have plastic balls, and you can drop the plastic balls. The glass balls are, your kids, your family, maybe, if your job, I mean, obviously most jobs are important, but you can let the dishes in the sink. That's a plastic ball that can stay for a minute. That can be dropped. Or even laundry. Like sometimes I'm just piling my kids' laundry up and not folding it. It's clean, but they just have to go through it and find it. You know what I mean?
Same. Yeah.
So I think it's just us being able to be like, okay, this is important, but this isn't that important right now. We don't have to have the Instagram worthy house every 5 seconds. Like, so I think that's a lot of people coming to themselves as well too, of being like, hey, we can live a relaxed lifestyle if we kind of choose to, for
Yeah.
So I
I
mean,
love that
I don't know. It's just
analogy.
personal growth. Yeah. Yeah. So that's a helpful stress analogy right there.
That's a good one. Everyone will have to go back to that and remember, is this a glass ball or a
Yeah.
plastic ball?
Yep.
That's a
And you
great
can
tip.
label them. Yep. So yeah.
Is there a current trend that you're seeing over social media in the health and wellness space that you don't currently love? Does that put you
Yeah.
on the spot?
Well, I mean, I guess I kind of already talked about, I mean, semaglutide, the
Mm.
GLP-1 agonist drugs and weight loss. I mean, I see like people's before and afters, and I lost 50 pounds in 3 months. And it frustrates me because, and I even see it in my community, people want the easiest, cheapest way to lose weight, right? And there's just, I don't know, I don't think people realize like how much damage that they're doing by not doing it the right way. And
Mhm.
metabolism, just overall health outcomes, gaining weight back. I mean, I think that's, if I were to say one, that's one of my biggest things right now. And skinny doesn't mean healthy. I think people are they're seeing all the success, or even and I think that's why I'm kind of relatable. Like I mean, I still have my C-section weight. Like I'm not the bulkiest, most toned person ever. So, and I'm okay with that. And I think I want people to be okay with themselves as well too. Like if
Yeah.
you're doing all of the right things and you're taking care of yourself and you feel good, like you do not have to look a certain way. And you're not going to.
Yeah.
And the women that are toned and look amazing, like I'm so happy. Like they are awesome. And I'm sure if they feel good, like I want them to just feel good. That's all that I want. You know what I mean? So
Yeah.
I think, yeah, it's kind of pushing we should look a certain way and be a certain way when it's not the healthiest. Does that make sense?
Yeah, definitely. No, it does make sense. And
Yeah.
I think those are things like even when you are in a good headspace, like I feel like obviously you are and I've come a long ways, but it's easy to get that like little inkling of like, well, if I only looked a little more like this, and it's like, no, look how far you've
Right.
come and where you are mentally and physically so aligned. Like that
Yeah,
is beauty in itself and also maintaining it too because
for
that's
sure.
important.
For sure. And that's I think what I like a lot of it, whether it's through the Do Good or even in my clinic, like I want women to just be comfortable with who they are and not compare
Mhm.
themselves. And I think when we get those habits and we know how to take care of ourselves, it becomes empowering,
Mhm.
and it's confidence from the inside out. Like that was our last event, confidence from the inside out. When you heal yourself from the inside, everything on the outside, I mean, it shines through, right? Like you feel good about
Mhm.
yourself, you feel good in how you're feeling. I mean, everything just So you don't have to
Always.
look a certain way.
Definitely not. I Yeah, I agree with you. It's always so tricky, especially getting on social media, but I think like you said
Yes.
with the semi-glutide thing too is when I went through my weight loss after my last baby, um
Hmm.
it wasn't even so much my pregnancy weight because I kind of lost my pregnancy weight and then I had a whole bunch of hormone stuff. That vitamin D like
Yeah.
was all out of whack. So I basically gained it all
Yeah.
back. But it was like a slow and steady process. And talking to my
Yeah.
sister about it too, 3 years later, she's like, "Wow, what'd you do?" And it's like, dude, like every day the time was going to pass anyway, so I just showed up and did what I could for that day and
Awesome.
like you said, met yourself at where you are now and it kind of elevated each day with what you could do. And then you look back and you're so grateful that you took the time to do that because you're not playing the like, "Oh, it was a quick fix."
Right. And I mean, you probably learned so much along the way
Oh,
as
so
well too.
much.
Like about you, I mean, the personal growth. I mean, and yeah, you can do amazing things. Haul out these big animals. I've seen some of your pictures. I'm like, that's me this year. I'm doing that this
You
year.
do. I hope you do. I love that.
I don't know. We put in. I don't know what I'm gonna draw. I'm like the only hope for the family this year. So
Really?
my brothers are telling my yeah,
You have all the points?
my dad. I the, honestly I don't really know. My dad's always put me in, and now my husband's putting me in.
Yeah.
So
I'm
I know
excited.
elk, deer. I could. I don't think they put. Oh, I think they put me in for points on a bear because I don't know. Anyway, I'm gonna try. Okay.
You should. And you should start putting in for bear because that is my favorite hunt.
I
But
have
you
a lot of
should.
points for bear.
Do you?
Like I have a lot of points.
Okay.
I don't know if it already happened or
It
not,
did.
but
But
I don't
we'll
know.
like next
Okay.
year. I got you.
Yeah,
It'd be so
I
fun to
think they put
take
me in for a
like
point.
another woman hunting. Like we know the place, we know the
Okay.
spot. I got you. It would be so fun.
You'll take me?
I'll take you,
Okay.
which makes
Because
it
I
even
probably
more
will
fun.
draw next year.
That's
Like they
incredible.
were, because I think I told them I couldn't this year. I'm like, I just, so much is happening.
Yeah.
I don't know. So they just put me in for a point. So because they wanted to hunt bear this year and I crushed all of their
Oh
hearts.
no. I just got really excited
My
for
dad and
next
my
year.
brother.
Yeah,
It could happen.
it
So,
could. Could. And hopefully you
hey, we'll
get
have to
elk.
stay in touch with that.
Yeah. And hopefully you get an elk too,
Yeah,
because
elk deer.
fill your freezer and
Yeah.
get all
Oh
your
yeah,
protein in.
I'm sure. All of it.
All
I
of your
mean,
protein in.
yeah, yeah. So, okay, we'll have to be in touch for that when
I
that all happens.
Yeah, we will. I can't wait to see. You'll have to post if you draw out and you'll be fine packing all that out because I see you run. Are you running a marathon, a half marathon?
It's like a half, but it's called the Women's Epic.
Okay.
It's 12.4. It's like 3,900 elevation gain
Oh, wow.
up at Brighton Resort. Yeah, I'm scared.
When is that?
So I am July 27th. I am taking it very seriously. Like I'm going crazy on training right now.
Yeah, you seem like you're out
I'm not,
training.
yes, I am a lot. And that's kind of why I started the Pro 6 because I just felt like I was watching my nutrition. I just felt like I was kind of like not improving. And I don't know, I've built a lot of muscle since starting that. So we'll keep trying and
Yeah. And
I'll be
helping your
learning some
endurance, I would
skills.
assume.
Yes, yes, for sure. So,
Very cool.
but
And you
yeah, I have
teach
like 17
classes?
weeks.
Oh, wow.
Um, oh, I don't teach them. I just support one of
Oh,
the
okay.
girls that kind of branched out and she wanted to do Zumba and I'm like, yeah, I try to get behind everybody that's trying to do something amazing. So, yeah, so I just go support her, kind of help push her
Best
along.
cheerleader.
So,
Yeah. Wow.
that's what I like to be a cheerleader.
You like to be
So,
a cheerleader.
yeah.
Support everybody. Yeah. See, you're physically there and you're training. And I like that when you put your mind to something, you definitely are like all in and are training for the
I'm
run.
all in.
Is this your first run?
Yeah. No, I've done some other halves and some other trail
Okay.
runs, but the description on this one has me a little scared. It's hell on the mountain is in the description. So
You're like,
I'm
challenge
like, oh,
accepted.
I did. And now like every day I'm like, I tell my husband, like, what have I done? He's like, you're going to be fine. Because there is a shorter one.
Mm.
I was like, should I just do the shorter one? It's like 5.8. He's like, no, because I'll just hear about how you should have done the longer one. So I was like,
Yep.
okay, we're committed.
Awesome. Is it up like on,
Yeah.
is it trail running?
Yeah, it's trail. That's what they say. It's trail running. I haven't done it before. Um, but yeah, it's at the Brighton Resort. It seems really amazing and it's all women.
Okay.
So
Yeah.
I don't know. I guess it's my first time doing it. So there's another one in September that I'll probably do as well too. So, if I live.
I like how you're nervous, but already planning to do the next one.
I
That's
know.
exactly how I
Yeah,
function.
yeah.
I would like
Like
to do more
we
running.
know. Yeah. Well, you do a lot of strength training though, right? Like,
I do a lot of strength training. I do love my walks because that was another thing that made a huge difference
mhm,
in my journey of feeling better and healing
yeah,
myself and meditations. I love walks. And I really love doing inclined walks with my pack because that's
yeah,
very functional to what I would be doing in the mountain.
yes.
Um, but yeah, I would love to do running more. I don't know. What are your thoughts on like running and like cortisol? Do you feel like that impacts your hormones? Because I've
I
heard
feel like
people
it
say
can.
different. Yeah.
I mean, here's my deal is like if you're not supporting yourself, like I'm eating a ton. Like I told my brother how much I was eating. He's like, "Holy crap." He's like, "You're not gaining weight?" I'm like, "No, because I'm
You're
using it." So I
burning.
think if it's not, I mean, if you're physically like mentally and physically like it's stressing you out completely, then yes, it's going to
Hmm.
increase your cortisol levels, right? And that's going to affect your hormones. But I'm not really like just jumping into it. I've been training for quite some time and now I've just upped my training a little bit. So I feel like
Hmm.
personally, and depending on the athlete or depending on the person that's doing it, it's okay. I don't think I'm going to be running in my 40s because of how it might impact my
Hmm.
cortisol and my joints and those types of things. I might only
Yeah.
last a few more years. So I think running can be unhealthy, but if you're doing it the right way,
Hmm.
it's healthy, if that makes sense.
Yeah.
So,
Yeah. That's kind of where I've been. I'm like, where do I want to go? But I have been implementing more running because I find a lot of mental clarity after the fact of like just happiness, euphoria
yeah.
that I really enjoy.
Yes.
So I've been implementing
Yeah.
it more into, my functional fitness and my lifting and kind of
Yeah.
adding it to it. And I'm
A
enjoying
little
that
bit.
so far. But yeah, because I'm like, I
Yeah.
don't want to hurt. I was having knee problems a couple years ago and I didn't want to like injure
Hmm.
myself trying to run a bunch of miles and then not be able to go outside and do stuff with my kids because I wanted, you know what I mean? It's like finding that balance.
Oh, yeah, for sure. And that's the thing. You don't have to go endurance run like a lot of you can just run a couple miles but also too, like you said, like knee problems. Like I did injure my knee running, and I think it's because I wasn't strong enough yet. Does that make
Mm,
sense? Like
mm-hmm.
I didn't train, I didn't build like, my muscles and my thigh and I mean, I wasn't ready to go as crazy as I did. So,
Yeah.
I mean, it's preparing your body. And strength training is a huge, huge part of running. I mean, I think people that are, trying to get into running should really start with strength training and then
Interesting.
move their way into it. But listen to your body.
Yeah,
That's what I always say
that's a
too.
great tip. Yeah,
Listen to it.
I've been
Hmm.
impressed. Like I'm not like, I'm not I will say I'm not like a fast runner, but I also have the mindset of like I'll just keep going whether this body wants to or
You're
not.
mentally
Yeah,
strong.
I'm mentally
Yeah.
strong, but I've been proud. I think like you said, the training that I have done leading up to it has definitely made it easier than it used to
Oh,
be
yeah.
for sure. So, that's kind of exciting and has
Oh,
me
yeah.
being like, "Oh, now what can I do?"
I bet you could do this thing probably better than me. If you're packing animals out, you could
I'm
probably
like,
do
I could
this.
hike it out. But no, we did just do a 5K this last weekend and that was pretty cool. So, yeah.
So see,
Yeah.
that's where it starts. You do that, and then all of a sudden you're just. I'll have to send you the reel that I sent my mom because she always makes fun of me of like all this. She's like, you can just pay me that money and I'll run you for 13 miles. I'm like, what about
Right?
my medal? And she's like, so I
Right.
sent her a funny reel about running. Anyway, it's kind of funny.
That's too
I'll
funny.
just send
Yeah,
it to
I'm
you.
I'm too competitive. I get it for sure. Kayla, I
Yes.
have loved our
Yes.
conversations. I'm sure I could ask you 1,000 more questions and learn so much from you, but you're obviously a busy mama and you've got your clinic hanging out waiting for you. Where can everyone find you? How do they work with you? Let us know any adventures you have coming along. And yeah.
Uh, so we're working, this is kind of like my butterfly year. So we're kind of working on um like doing like a website and all of that. But really through Instagram, everything is happening through Instagram right now. So if anybody wants to reach out, they can through there. I'm usually pretty good at answering on there. We're also opening like a lot more online virtual options for my clinic as well too. So if
Oh,
anybody
cool.
has questions about that, yep, just reach like I said through Instagram. Um,
And what's your Instagram
things
handle?
coming. Is it? Oh gosh, you had to ask me that.
No,
It's
sorry.
Kayla Olson NP.
Okay. I'll put
I'm
it
like,
in the
what is it?
description too, but
Yes, Kayla Olson with an O-N.
okay.
I didn't know that was a big thing. O-N and then yeah, just NP. So
Okay.
yeah, you can reach me through there, and then yeah, we're planning our next Do Good event. That one will probably also be virtual as well too, so more people from all over can join in as well too. So hopefully
Very
that
cool.
news will be coming up soon. So
Yes, I can't wait to see it. And when I see it come out, I'll share too, because I think it just is such a fantastic idea. And especially to be able to do it virtually, because you can connect with so many more people and help so many more people that way.
oh yeah, I had that request at our last one, so I was like, I will figure that out. Like I said, it's my butterfly year.
Well, thank you
Yeah,
so much for taking the time to come on, Kayla, and answer all my questions.
of course. Thank you so much for having me. It's been so fun.
You're welcome.